Welcome back to Good Morning Black Hills. Today we are talking about interventional pain management. That is a medical specialty that uses minimally invasive procedures to diagnose and treat chronic pain conditions. And one of those conditions that it can help with is diabetic neuropathy. So joining us this morning to tell you a little bit more about this is Dr. Ptacek, double board certified pain specialist at Rapid City Medical Center. So first of all, let's talk about diabetic neuropathy. What exactly is that for some of our viewers who might be curious at that, big term, right?
Sure. Thanks, Umberto. A pleasure to be here. So diabetic neuropathy is essentially when diabetes, which is a condition with high blood sugars, gets into the body, and it actually affects the small blood vessels and the nerves. And typically what patients experience is a burning or tingling sensation that starts at the toes and starts creeping up the legs. This can be fairly disabling. It affects sleep with the burning feet. It affects balance. It can affect a lot of different activities, and it causes usually high pain levels.
And knowing that it can cause pain, I mean, how do patients get this treated, or what is the procedure to kind of get it diagnosed and treated?
Sure. So that's a great question. In South Dakota, we have about 80,000 people who have diabetes, 5,000 new cases a year. And on average, people have diabetes for 3 to 7 years before being diagnosed. So it's important to see your primary care doctor every year to get those tests to make sure that you're not developing diabetes.
Right. And if left untreated, I mean, what are some of the things that can happen?
Sure. So essentially, diabetes affects numerous organ systems in the body, and it's estimated that about 30% of patients have either heart disease, kidney disease, eye disease, or this diabetic neuropathy before being diagnosed. So very important to see your doctor and have these diagnoses.
And really quickly, if our viewers are kind of interested in learning more about this, or maybe if they are kind of worried that they might have this, I mean, where can they go? Who should they go for? Primary care provider? How does that,
So of course, if you have pain, there's a lot of things that we can do for diabetic neuropathy. The mainstay is medicines, which traditionally have really high side effects. So gabapentin is something we prescribe, but it can, cause confusion, sleepiness, dizziness. There's a new revolutionary procedure that we do here at Rapid City Medical Center, and it's basically using spinal cord stimulation to quiet the nerve signals down.
Gotcha. And then is that, I mean, when it comes to that kind of procedure, or at least that kind of treatment, is it painful? I mean, how does that work?
So very painless, and typically why we would use spinal cord stimulation is if medicines are failing or causing side effects. Patients typically have a trial of the therapy first. It involves an epidural placement of a small electrode that quiets the pain signal down. So we do this with numbing medicine and some sedation, and patients typically do really well with about an 80% response rate.
Excellent. All right. Well, thank you for joining us here on Good Morning Black Hills. It's been an insightful conversation we've had this morning, and hopefully some of our viewers took a lot out of it. Thank you.